Zoonotic disease,
Prion disease, Prion disease, Prion disease, transmissible spongiform encephalopathies, TSE, infectious amyloidosis, unconventional slow virus degenerative encephalopathies. Introduction. Prion disease or TSE are a family of rare neurological disorders affect both human and animals, characterized by long incubation period, neurological loss, failure to induce inflammatory response. Prion disease are usually rapidly progressive and always fetal. Causative agent. Causative agent. Causative agent of TSE are believed to be prions. Term Prussianer, diameter 25 to 50 nanometer in size, able to induce abnormal folding of a specific normal cellular protein called prion protein. Prion protein most evidently in the brain. Abnormal folding leads to brain damage. The prion is resistant to physical, high temperature, ultraviolet ray, and chemical agents. It is non-immunogenic and highly stable molecule. It produces slow and progressive infection. Identified prion disease. Identified prion disease. Animal prion disease. Host affected. Bovine spongiform encephalopathy (BSE), cattle. Chronic wasting disease (CWD), deer, scrapie, sheep and goat. Transmissible mink encephalopathy (mink). Feline spongiform encephalopathy cat. Undulate spongiform encephalopathy. Identify prion disease. Identify prion disease. Human prion disease. Creutzfeldt-Jakob disease (CJD). Creutzfeldt-Jakob disease. Variant Creutzfeldt-Jakob disease (VCJD). Gerstmann-Straussler-Scheinker syndrome. Gerstmann-Straussler-Scheinker syndrome. Fetal familial insomnia. Kuru. Bovine spongiform encephalopathy (BSE). Bovine encephalopathy (BSE), also known as mad cow disease, characterized by a progressive degenerating condition giving rise to spongiform appearance of the brain. Host, a progressive neurological disorder of cattle. Geographical distribution, United Kingdom. History. The first case of BSE in a cow, 1985, officially diagnosed in 1986. BSE became a notifiable disease in June 1988. Feeding of cattle or sheep offal to other beef cattle was banned July 1988. Bovine offal was banned of human consumption in UK and Scotland from 1989. Bovine spongiform encephalopathy (BSE). Symptoms: change in mental state and behavior, abrasion and excitability, fixed gaze and humpback, postural anomalies, locomotor dysfunction, ataxia, tremor, falling, transmission, consumption of beef or beef product. Diagnosis, clinical signs and symptoms based on histopathology, prevention and control, thoroughly cooked beef and beef product before consumption, issue of animal health certificate from the government veterinary authorities of exporting countries, BSE free certificate, the animal imported from this country into India, create public awareness, education about its potential health hazard, careful handling of animal or meat, particularly the brain or spinal cord tissue. Creutzfeldt-Jakob disease. Creutzfeldt Jacob disease (CJD), subacute spongiform encephalopathy, rare brain disease effect on person per million population per year. Etiology classical CJD, post-human geographic distribution worldwide, mainly United States, higher incidence in cities. Source of infection, injection of brain and other tissue of scrapie infected sheep. Disease incubation period, infection with this disease lead to death, usually within 1 year or onset of illness. Symptoms, rapid onset of dementia, a range of neurological symptoms, walking difficulties, sudden jerky movement, sometimes visual disturbance. Diagnostic clinical sign, histopathology, CNS, MRI. Treatment, only suppurative treatment. Prevention, care during the handling of infected material and disinfection. CZD is not transmissible from person to person by normal contact. Variant Creutzfeldt Jakob disease (VCJD). Characteristics: classical CJD, variant CJD. Median age at death 68 years, 28 years. Medium duration of illness 4-5 months, 30-40 months. Clinical signs and symptoms: dementia, early neurological signs, prominent psychiatric behavioral symptoms, painful diastasis, delayed neurological sign. Periodic sharp wave on electroencephalogram, often present, often absent. Pulvinar sign on MRI, non-reported, present in 75% of cases. Presence of florid plaque on neuropathy, rare or absent, present in large numbers. Immunohistochemical analysis of brain tissue, variable accumulation, marked accumulation of protease-resistant prion protein. Presence of agent in lymphoid tissue, not readily detected. Increased glycoform ratio on immunoblot analysis of protease-resistant prion protein, not reported. Marked accumulation of protease-resistant prion protein. Unit 3, zoonotic disease. Amobiasis, amoebic dysentery, amoebic hepatitis. Etiology: Entamoeba histolytica is the major cause of amoebic dysentery. Epidemiology: 0.5 to 50% of the population worldwide harbors histolytica. Higher rate underdeveloped country, 1 to 3% population of the USA infected is associated with poor hygiene. Principal host human, although dogs, cat and rodent may be infected. Morphology: trophozoid and amoeboid appearance, type 15 to 13 micrometer, more invasive strain larger, single nucleus with small central karyosome, defined granular endoplasm, may contain injected erythrocyte. The nuclear chromatin is evenly distributed along the periphery of the nucleus. Cyst, spherical, refractile wall, cytoplasm contain dark staining chromatoidal bodies, 1 to 4 nuclei with a central karyosome, evenly distributed peripheral chromatin. Life cycle: infection occurs by injection of cyst on fecally contaminated food or hand. The cyst is resistant to the gastric environment. Passage into small intestine where is decysted. The metacyst divided into 4 and then 8 amoebae which move to the large intestine. Majority of the organisms are passed out of the body with the feces, but with large bolus of infection, some amoebae attach to and invaded the mucosal tissue, forming flag-shaped lesion bomb crater. The organism assists for mitosis and are purged through with feces. There are no intermediate or reservoir hosts. Symptoms: acute, frequently dysentery with necrotic mucosa and abdominal pain. Chronic, recurrent episode episode of dysentery with blood and mucus in the feces. There are intervening gastrointestinal disturbance and consumption. Cysts are found in the stool. The organism may invade the liver, lung, and brain, where it produces abscess that result in liver dysfunction, pneumonitis, and encephalitis. Diagnosis, symptoms, history, epidemiology, laboratory diagnosis. Cyst in the stool. Distinction must be made from other non-pathogenic intestinal protozoa. Example: Entamoeba coli, Entamoeba hartmanni, Dientamoeba fragile, Endolimax nana, Iodomyia bischi, etc. Treatment: Iodoquinol is used to treat asymptomatic infection. Metronidazole is used for symptomatic and chronic amoebiasis, include extra intestinal disease. Thank you.